Hello, we are the telehealth debate group. I am George Rader speaking.
My name's Avery Pulowski.
I'm Grace Salerno.
I'm Grace Cruz.
And I'm Jackie Saprig.
So we will be covering telehealth technology threatens the future of special education and ABA. Grace Cruz, as well as Jackie Spirik, debating telehealth is beneficial in the field of ABA, and Grace Salerno and Avery Pulaski debating the risks of telehealth in ABA. Two questions that we'll be covering in the presentation asks. Question one, how can we make telehealth an accessible option for families in lower social economic status and rural areas where technology can be a barrier? And also question two will ask, how can a BCBA talk to a family about the benefits and risks of telehealth so that the families can make an informed decision about whether or not it is a suitable option for them? First question will be covered by Grace Salerno, or Grace Cruz.
Thank you. Hello, everyone. I will be addressing why and how it would be beneficial to have telehealth in the areas of lower socioeconomic areas as well as rural areas. In recent years, telehealth has been extremely helpful for some seeking treatment for an array of situations, like a quick medical diagnosis, like a sore throat per se, all the way to emotional therapy. Yet not many companies provide telehealth services for the autism community, as the industry norms were to provide in-home, at-center, or classroom interventions with one-on-one therapy. As per the National Research Council in 2001, early intervention has better results for children who are diagnosed with ASD. It also is expected that children who are obtaining services stay consistent with their intervention to avoid creating maladaptive behaviors or lose the headway that they've gained throughout therapy. Unfortunately, in 2020, due to COVID-19, many companies had to shut down due to the stay-at-home orders. The orders caused many students to be stranded during these imperative interventions. Although this also opened the door for some clients to receive interventions via telehealth services. Many companies had to get creative in order to provide their much needed services, and telehealth for intervention of ABA became a bit more common. This solution paved the way for many companies continuing to provide ABA services via telehealth. Although not every situation would benefit telehealth services, one cannot ignore the fact that virtual services can be of benefit for a certain group of individuals, as well as under certain circumstances, like those who live in rural communities or rural areas. With a simple tablet and internet connection, the door becomes wide open. One would argue that those living in rural or impoverished communities may struggle to obtain services. Those may be many reasons parents don't jumpstart interventions early in their child's life. It could be of lack of access for those living in rural communities where the closest therapy center could be a long commute or not within their range at all, to parents not having the means to secure a spot for their child due to finances. Businesses may decide not to provide services in such remote locations as there aren't enough clients to justify the cost for such a small population. As per Mohammed et al. In 2016, the ASD prevalence was reported for rural areas as being 0.9% and 1% in the urban areas. In 2020, the CDC reported that as of 2016, in the US, 1 in every 54 children were diagnosed with autism. The CDC also reported that the rate of birth in 2016 was 3,941,109 children. That would equate to over 650 children who were born in 2016 alone from a rural community that statistically would have been diagnosed with ASD. One cannot argue that there's a demographic that needs services, whatever means necessary. It does come with a cost. As I mentioned earlier, finances may be a reason that individuals do not seek early intervention. Luckily, there are government subsidies that can cover most, if not all, expenses incurred. Depending on the family's economic situation, some may qualify for Medicaid. Medicaid will cover the cost of interventions. Now, as far as the broadband and the equipment for individuals who live in populated communities, Xfinity provides a broadband service for as little as $10 a month. Those in rural communities, one can use CenturyLink or Verizon, which provides satellite services for those broadband services, which is not exactly reliable, but on occasions, if the weather permits, they can be helpful. And they range between $40 to $65 a month. If the families cannot afford the broadband services related to telehealth, the Federal Communications Commission, under the Emergency Broadband Benefit, provides a discount of up to $50 a month for broadband services. Now, should the expense of the equipment be a challenge in providing services, luckily the FCC.org also provides a $100 one-time discount for purchases of a tablet, laptop, or desktop. Thankfully, the Amazon Fire tablets can be purchased well under $100. The BCBA Ethical Code 2.09a, Treatment for Intervention Efficacy. Clients have the right to effective treatments. Behavior analysts always have an obligation to advocate for their client, and scientifically supported most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefit to the client and society. That being said, those who struggle to access interventions such as those in rural and underprivileged communities, a BCBA should attempt everything to provide services to their clients, just like those who stepped out of their comfort zone during the COVID-19 lockdowns. Thank you.
Thank you, Grace Cruz, for speaking. Up next will be Grace Salerno answering the same questions on how can we make telehealth an accessible option for families in lower social economic status and rural areas where technology can be a barrier.
Thank you, George. In regards to what the affirmative said, Grace Cruz, this is all with the assumption that clients and their families have access to telehealth. With access, there comes a couple things to consider. Firstly, the computer itself. The affirmative stated that clients need a device and internet. Most ABA companies do not provide computers or laptops and usually state that the families will need a way to access the internet before enrolling them in telehealth options. However, most people do own cell phones in this day and age, which could be a reasonable way to access telehealth. The affirmative mentioned economical ways to obtain broadband and devices. But this again is with the assumption that the families have decent services within the region and area. George, if you could. Steinberg et al. In 2005 created a visual map displays the broadband connection for the United States. As you can see in areas such as Montana, it is light gray, meaning that there is a possibility that broadband internet connection is very poor. And if you look at the entire state of Nevada, which is white, shows the complete lack of connection entirely. Michigan State University in 2019 conducted a survey to 3,258 students from 15 different school districts. They wanted to identify the types of devices students were using and also what the most common issues were in regards to having classes online. They found that, quote, only 47% of students who live in rural areas have high-speed internet access at home, compared to the 77% of those in suburban areas. Of those who do not have home access, 36% live in a home with no computer, and 58% live on a farm or other rural settings, end quote. It should be noted that this study was conducted with general classes and not in regards to special education, though. The Federal Communications Commission, FCC, George, if you could, mapped out the differences in cell phone coverage for major cell phone companies. The first visual here shows AT&T, and as you can see, coverage is pretty vast across the US. But again, if you look at areas in Nevada, the blue, which indicates coverage, is either lighter or non-existent in areas. Also, if you look at areas of Tennessee and Virginia, there's a gap of coverage. Next map. The next map is of T-Mobile's coverage, indicated by light purple, which in comparison is not as dense as AT&T. And you can still see that even more states in the Southwest do not have adequate coverage. If you look at Nebraska, T-Mobile barely has any coverage in that state. And again, there still is that gap of coverage in areas of Tennessee and Virginia, which only increases slightly the more south you go on the map. Next visual. The next map is of US Cellular's coverage, indicated by yellow, which you can see that only a few states have coverage at all. Next. The next map is of Verizon's coverage, indicated by red, which is the company with the most coverage. But the Southwest still has blank areas, which can be especially seen in Nevada, Montana, and Idaho. And in the East, Tennessee and Virginia areas again. Last one. The last visual provided is an overlay of coverage of all the companies mentioned. As you can see that none of the Southwest states have complete coverage. And the sparsity of coverage can also be seen in areas of Tennessee, Virginia, and Pennsylvania. As we know, telehealth needs are not centralized to populated cities and states, but are needed across the entire United States.
Thank you, Grace. Also, Grace, for your debate and answering our question. You both made very valid topics and provided great references. Moving on, we'll be answering question 2. How can a BCBA talk to a family about the benefits and risks of telehealth so that families can make an informed decision about whether or not it is a suitable option for them? First up speaking will be Jackie Sapir.
Thank you. As George said, I will be addressing the benefits of telehealth that should be shared with families before starting. Telehealth allows patients to connect with many different practitioners and is used throughout healthcare. This can be done using a tablet, computer, phone, any of those to connect with a healthcare provider. Similar to using FaceTime to connect with family that live in a different state, this is a great way to connect. Most recently, COVID-19 has impacted many families around the globe. This is an upper respiratory illness, symptoms of a dry cough, breathing difficulty, and can be pretty serious. One way to slow down this is to social distance. The use of telehealth protects both patients and physicians and families. During the pandemic, some clients are at an increased rate of losing acquired skills or can increase in behavioral issues if they are not regularly completing ABA services. According to one landmark study, 76% of participants transitioned to technician-delivered telehealth services during the pandemic. By using telehealth, many were able to maintain services. People are able to communicate with physicians without putting themselves and loved ones at risk when they are doing this. During these times, telehealth may allow some clients to see familiar faces and work with techs or BCBAs. With this scenario, more and more ABA providers are turning to telehealth to deliver treatments to clients. Before starting telehealth, a few benefits will need to be addressed to ensure these services will be appropriate for the specific client. Telehealth provides different methods of telehealth so that clients can receive the most appropriate services. Council of Autism Service Providers, or CASP, has identified 4 different types of telehealth for ABA: partial telehealth, telehealth direct, caregiver implemented, and caregiver consultation. First, I'll talk about partial telehealth. This model involves the technician delivering services in person, while the BCBA provides clinical oversight using Zoom or any other type of telehealth. This model has been shown to be effective for functional behavior assessments, or FBAs, preference assessments, behavior reduction procedures, and interventions to build social, language, and daily living skills. This may be beneficial for clients that may be more active and sitting in front of the screen may be a little more difficult for them. method can also reduce the amount of people in the setting or the room, making it more one-on-one with the client and the tech, and reducing having a BCBA or a parent. Next is the telehealth direct services. This delivers ABA therapy directly to the client using video or any video conferencing. Providers must first assess whether the client has the skills to respond to interventions delivered through this method. Some of these skills include basic joint attention and the ability to follow one-step instructions. This may be best for clients who are able to sit down for an extended period of time. Next is the caregiver implemented services. This model allows caregivers to continue to implement protocols once they have been trained. The provider must first consider which treatment protocols the caregiver can be trained on, and then this can be delivered without being modified or simplified. BCBAs can help caregivers assess the training plan using Relias or any other type of technique, and this can eventually be implemented at home. Lastly, the caregiver consultation for caregivers who cannot deliver services directly to clients for any reason. They may benefit from training with the BCBA. This type of telehealth will mostly focus on challenging behaviors, providing feedback and reinforcement, problem-solving daily routines, and nonetheless, there are multiple different methods of telehealth that can provide the most effective services for a client and their needs. Thank you.
Thank you, Jackie. That was very informative. And now up next, debating on the same question is how can a BCBA talk to the family about the benefits and risks of telehealth so that families can make an informed decision about whether or not it is a suitable option for them. Will be Avery Pulowski.
Hi, I'm Avery Pulowski. I'm going to be addressing some of the risks that are associated with the use of telehealth for ABA services. First, as Grace Salerno mentioned previously, there are some concerns relating to internet connection and devices. So not everyone has great internet connection. There may not even be a provider that they can access in their area, or the connection may be poor, where when they're doing their ABA therapy, it could be, the screen could be freezing or breaking up, making it difficult to hear the BCBA or technician. Additionally, for financial reasons, it may be difficult for some clients to access devices necessary for this. Also, another drawback of the use of telehealth would be that when we're not there in person, it's a lot more difficult to assist with various things. For example, if a client is having their parent or caregiver assist them with a program, we are not there to physically prompt and assist them. And enforcement is very important for the effectiveness of treatment to immediately deliver a reinforcer upon correct responding. But through the screen, you can only give verbal praise, and also it depends on the availability of the caregiver to assist the client with their treatment as well. Off of that as well, another issue can be the client's attention span. For example, for young children, there are many clients that are as young as 2 to 3 years old. It could be very difficult for them to sit in front of a computer screen, tablet, or phone, or whatever device they may be using for an extended period of time. Another factor could be their environment around them in their home. It may be noisy, or other distractions may be present, like a TV or their siblings, or other things that may be going on in the home. Additionally, with the challenge of clients sitting in front of a screen and using telehealth, it may impact the duration of their sessions. In-person sessions, they can last anywhere from 2 to 4 hours, depends on the client, of course, and recommendations, but it's very difficult for many clients that we service to have sessions that have the same duration when it comes to using telehealth, that it's just not as realistic for them. Also, another thing to consider would be the ethical implications of the use of telehealth. And to guide us through that would be the ethical guidelines that are provided by the Behavior Analyst Certification Board. A couple ethical codes that I would like to address would be code 2.09, which would be the right to an effective treatment. Is the responsibility of the behavior analyst to always advocate for their clients and try to give them the best services possible so that they can have an effective treatment and a positive impact on their lives and help them to functionally live in their environments. And so by using telehealth, they may not be getting as effective of a treatment as possible, as we cannot be there in person to do their programs, to train their parents, and to help with challenging behaviors that may occur as well. The other ethical code that I wanted to address would be code 2.03, which is referencing the client's privacy and confidentiality. So as we all know, in the field of ABA, it's very important to always keep our clients' information private, and we would never share it with others, as they do not need to know identifying information about clients. And when providing telehealth services from the home, if an RBT or a BCBA is using their computer from home, it's very possible that other individuals could be present in the home, or there's also just more risks associated with the use of telehealth that it could reveal their identification or other information about the individual. And also, there are the risks of using the internet in general when it comes to the individual's information, that it could be found online, possibly somehow by someone, if they're not using a secure platform. Additionally, Code 2.01 states that we must provide services conceptually consistent with behavioral principles and based on scientific evidence. And by using telehealth, we may not always be able to follow all behavioral principles and use scientifically based practices like that are evidence-based if we are not able to implement them as effectively. So next, going into our next slide here, we'll talk more about the 7 dimensions of ABA as mentioned by Bear, Wolf, and Risley, 1968. So some things to notice here about this illustration is generality is something that I find very important when we are providing ABA services. So if the client is able to perform a skill in front of a screen, how does that translate to when they're in the real world and in their lives interacting with other individuals? They practice it in front of a screen or just with the one caregiver that's helping them. It's not as likely that they're going to generalize those skills the way that they really should be to give them the most effective treatment. So generalization is something very important, and I believe that by doing in-person services, we can address this a lot better by practicing skills with different individuals, different contexts, and different environments. I know that there are some restrictions due to COVID-19 that may not always make this possible, but we should always try to generalize skills to the best of our ability. And then additionally, another aspect, one of the other dimensions of ABA would be effective. So they should always try to be an effective treatment, as I stated previously, and we may not always be doing our services to the best of our ability using telehealth. And then also, we look at the dimension of applied. So we always aim to make behavior change that's meaningful and socially important to this individual's life. And so that relates to the topic of generalizing skills that I mentioned previously, that that we always want to make changes that are going to make an impact on their lives, that can help them to function better in their environment and just better their lives as a whole. And by using telehealth, we may not be able to address all environmental factors and be able to see the whole picture if our view of the client is a bit more limited by using technology in that manner. And then let's see. Additionally, another thing that's important too is that behaviors are maintained over time, as if they learn a skill now and then in the future they forget it and they're not able to use it. You know, we always want skills to maintain over time, and if they're only learning it in the moment via a screen of telehealth, then they may not be maintaining these skills and generalizing them to various contexts, as I said before. So another thing that I would like to say about telehealth would be that it's a great option for the various circumstances that arise due to COVID-19, as there are many restrictions and limitations that may occur, whether it be limiting our community outings to practice different skills, or the people that we interact with if they have symptoms. So it could be a great option in those circumstances. However, I don't believe that it is built for the long-term use for a client, because it's better than, the use of telehealth is better than no treatment at all in the cases that there may be COVID-19 symptoms present. However, if this is the only option for a client over an extended period of time, they may not have the same rate of skill acquisition, and they may not be able to have the same benefits that an individual receiving in-person services may have. Additionally, another thing that I would like to address would be that family and parents and all the individuals that are involved in our clients' lives, that it's so important that they're involved and know how to help their child or a family member, or how whatever the relationship may be to that individual. So we can best train parents in person. We can model interventions for them, show them how we prompt the client. We can show them how we, our interventions with challenging behaviors that they may have, and how to best handle different situations. When we're limited to telehealth, we often are limited to verbal feedback, verbal information that we're giving to them. So that limits us a little bit. Behavior skills training is a great tool that we can use, and it works best when in person. We can model and role play how to use an intervention and then give appropriate feedback. When using a screen, you may not be able to fully see how the parent is doing with their child and may not give the appropriate or the correct feedback if you can't see exactly what's going on. Additionally, something else that I think is highly important to the field of ABA is supervision. We always want to account for all RBTs are getting the adequate supervision that we need to ensure that our clients are receiving effective treatment. So something to think about when we're using telehealth for supervision. Again, related to COVID-19, this is a good option if your supervisor has had a COVID exposure, or they have symptoms, or they're waiting for their test results to see if they're positive or negative. In those circumstances, that's a great option, so you're at least able to talk to them rather than having no supervision at all. However, there are many situations where the supervision via telehealth will not be as effective, and I believe this because it's more challenging for an RBT to carry a device around when they're working with a client. there are many children and clients of all ages that are very active and move about very frequently, and that makes it more difficult to carry it around with them and implement our interventions accurately and effectively when we are concerned with other matters of technology. Additionally, another aspect of supervision that is impeded by the use of telehealth would be they can only give us verbal feedback, and they may not be able to see everything that's going on. So they can't fully train their staff in the appropriate way if they're not there. One of the great strategies for teaching is modeling. And if the BCBA is not there to model or fully explain new programs for the client, then that leaves room for error and not accurately implementing the treatment for the client. Additionally, another challenge of using telehealth would be when there are problem behaviors that occur. That's very difficult. If you have a device, you most likely will just have to set it down, and you don't want, in a lot of cases, you also have to use personal devices, and that puts you at risk of, ruining, damaging your own personal technology devices. So in those circumstances where clients are having problem behaviors, the BCBA is very limited as to the extent to which they can help us through that. So we covered a lot of ground related to telehealth here today in our debate. So we hope that this helps to give you lots of different perspectives about the pros and cons of using telehealth. There are lots of things to consider when choosing telehealth for your child or client as a BCBA. So we hope that this helps clarify a lot of information that we have about telehealth. So next we can take a look at our references. Thank you.
Thank you, Avery. Provided a lot of information as well. I'd like to thank everybody else on speaking on the behalf of our debate. Thank you.